time to go on the record with WRAL News.
Thanks so much for joining us for On the Record. I'm Lena Tillett. If you've lived in this region long enough, it's really easy to take for granted what it means to live in the Research Triangle. Raleigh, Durham, and Chapel Hill is home to three major research universities, NC State, Duke, and UNC Chapel Hill. It's also home to the Research Triangle Park, the largest research region in our nation dedicated to advancements in tech and medicine, and home to some of the biggest biopharmaceutical companies in the world. If a major medical trial is happening in this country, chances are it's happening right in our backyard. That is until this year.
Will be ending the flagrant waste of taxpayer dollars.
President Trump has tasked his administration with cutting costs across the government. And one agency's funding on the chopping block is the National Institutes of Health, or NIH. The Trump administration is proposing reducing the size of grants the NIH gives to universities and hospitals like Duke and UNC to conduct its research. They're proposing a cap on so-called indirect costs. That's anything from lab equipment used in the research to the transportation needed to get people to and from clinical trials. This funding reduction strikes at the very heart of what our region, the Research Triangle, does and is able to do. An analysis from the New York Times shows states like North Carolina and Pennsylvania could face disproportionate losses. Last year alone, our state got more than $1 billion in funding from the NIH, and many in our area are concerned about this. Last month, State Attorney General Jeff Jackson joined a lawsuit calling for a temporary restraining order on the cuts, and a federal judge has granted it for now. Jackson saying in a statement, quote, "This attempt to slash funding for research awards would cost North Carolina public universities hundreds of millions of dollars every year going forward. It would permanently diminish higher education in our state and severely damage many of our state's core industries, causing major layoffs." Very strong statement there. We also have some breaking news. That same federal judge has now ordered an injunction on the cut, saying there is a, quote, imminent risk of halting life-saving clinical trials. The Trump administration plans to appeal this ruling. Our two guests tonight can walk us through exactly what this all means for research in our area. Dr. David WRAL is an infectious diseases specialist, a professor, and the co-principal investigator of the Infectious Diseases Clinical Research Trials Unit at UNC Chapel Hill. And Dr. Colin Duckett is the executive vice dean for basic and preclinical science at Duke University School of Medicine. He also spent 15 years at the University of Michigan, leading their research unit. Both of you all steeped in research. Thank you all so much for joining me this evening. So I want to begin with the main question here. Dr. WRAL, is research at UNC being impacted right now from these proposed cuts?
Yeah, Lena, I could speak personally about this because I am a clinical researcher. I get NIH funding. And from my perspective, there's been clearly a chill. So there's been really concrete things that we've seen, like this move to try to reduce this cost sharing that we're talking about, where we get funds, but they help support the infrastructure. But we're also seeing a real chilling effect on research in general. So it's very hard to propose new research studies. It's very hard to think about applying for these funds when study sections that review these grant applications aren't being held. So right now there's almost like a stop of the work that we do, the mechanisms that keep research moving and going, including at UNC.
Are you seeing that at Duke as well, Dr. Duckett?
Yeah, we're absolutely seeing that. I would say that you can separate these two issues. The first one is the discussion about the F&A, this cost-sharing rate, this reduction that is being proposed, and as that goes through the courts, and as we think about that, obviously that has a chilling effect, just as David said. But really the sand in the gear of the funds that are being provided now. So across the nation, what we're seeing is a trickle of funding compared to what we should have at this time of the year. So over $1.5 billion have not been released for funding that's actually badly needed right now.
What types of research trials are being impacted?
So research studies run the gamut, and as you said in the intro, this is really an area that stands out in the diversity of research that's done. Basic science in laboratories, clinical trials like we're talking about that involve people. This is cutting across all that type of research. And let's be clear, The NIH is just not some bunch of people in some building that nobody thinks about in an ivory tower. The research that they do and they fund is so important to our everyday lives. If you've had an MRI, thank the NIH. If you're taking a statin to reduce your risk of heart attack, thank the NIH. If your kid has peanut allergy and is now being treated successfully to not have a bad reaction when they encounter a peanut, thank the list goes on. And this is all because of the research that NIH funds. And there's countless examples of how much of an impact this is. There's a lot of talk about being great, right? The greatest, we're the greatest, this is what should be great. We have the greatest infrastructure for biomedical research in the world by far. And that's being threatened by what we're talking about right now.
Let's talk about this specific proposal for cutting indirect costs grants, right? Talk about how that normally would work for a particular grant. They're proposing a 15% cap on these indirect costs. What is it now, and how does that normally look?
Yeah, it's a great question. So if we take David as an example, if David writes $1 million grant, let's say he applies for a grant that he's going to get $200,000 a year for 5 years. That is the grant that he receives to do the science, to do the experiments, to run the trials, to pay his people, to pay for supplies, you name it, right? But beyond that, what institutions like UNC and Duke get, they get these things called indirect costs. Now, that would be, it's in the high 50s for us, low 60s percent
of them, right? Covering those costs.
So we would get another, let's say 60% roughly on top of that, right? That pays for the buildings, for the heating, for the really expensive equipment, for all of that infrastructure that's needed around the grant. And so a great analogy, I think, is to think about a car. If you buy a car, you don't expect the pieces to show up, at your house, and you have to assemble them. You need a factory. You need an assembly line. You need people. You need that expertise. That is what those indirect costs pay for. But most importantly, I think beyond that, this is a sharing relationship. It doesn't pay for all of it. I'll give you an example at Duke. Last year, we received $362 million in indirect costs, but the university put in 240. So it's really a sharing relationship between the institution like UNC and Duke and the federal government. And that's a relationship that we've had since just after the Second World War. Those calculations are very carefully made. Our books are open, they're audited. It takes a long time to reach that agreement as to what that percentage is.
The Trump administration says a university like Duke has a huge endowment. You should be able to cover the full cost of indirect costs for maintenance, for equipment, or for hiring people. What do you say to that?
Yeah, it doesn't work that way at all. So if David treats a patient who decides, because they're very grateful from the treatment that they had, that they want to make a donation to David's research, then they will make a specific donation that is tied up and is specific to that individual. This is part, and you scale that up, that's a very large part of what the endowment is. Legally, it cannot be used to pay for the electricity bill, to pay for the buildings. It was never intended to do that. That agreement was made to specifically give it to that individual. So to unlock that and take that money would be extremely challenging for us to do. And as I pointed out, we do that anyway. We do with the freedom that we do have, money that comes from the health system or from the university, we use that money to help with the cost sharing as it is today.
And what's the accountability structure look like for managing these indirect costs? Because the Trump administration also is calling these budgets bloated, saying that we don't know where some of these dollars are going. You say it's going to light bulbs. Is that true? What do you say to that?
Right. So one thing that's important to understand is where these numbers come up. The universities or the entities don't just invent what percent they want. There's a process, a rigorous process, where government officials come and do audits and inspections and come up with a rate that's different. Duke is different than UNC, that's different than Harvard, that's different than the University of Alabama. So this is a process that's been going on for decades. And it's very, very clear that these indirect costs support many things that the government requires us to have. An ethics board, for instance, or a safety board, things that we would all want to have, part and parcel of our research, are paid for with this. So it's not some sort of slush fund. Also, not every entity, not every university has an endowment, or they have an endowment that may be run out in just a few years at the most. to support this kind of work that we're talking about. The infrastructure, the place, just having the ability to do the work, we need that infrastructure to be existing, and that pays for itself over time.
Okay, we have a lot more to get to tonight. Coming up, dollars and cents, what a new study is showing research dollars produce for our local economy. Stay with us. Thanks for staying with us. Back now with two top doctors and researchers in our area discussing the impact of NIH funding cuts to universities and to hospitals. We are very fortunate here at WRAL to have a health reporter, Grace Haba, and she did a story last year about a trial that took 16 years and involved 2 universities. But there was a breakthrough in malignant brain cancer patients. Take a look.
16 years ago, in labs hundreds of miles apart, Dr. Daryl Bigner with Duke and a team at Johns Hopkins could only hope a gene mutation discovery would lead to a new cancer drug.
I have been working on malignant brain tumors for 50 to 60 years, and it's extremely gratifying to finally have a breakthrough that we know is going to help a significant number of patients.
And 16 years ago, Rebecca Richmond had no idea one of those patients would be her.
I have an 11-year-old daughter. When I was diagnosed, she was 3 years old. So a lot of it goes through your mind of the things that you could potentially miss and the things that you want to prepare her for that you might not be around to do so.
The Durham mom was one of the first patients in a clinical trial to be given the drug vorasidenib for treatment of her low-grade glioma.
There's this mutant protein, this IDH mutant protein. It produces essentially a chemical that causes tumor cells to grow. And what the drug does is it actually inhibits that mutant protein.
The drug was shown to help slow tumor growth, giving patients like Richmond more time and another option besides more chemo or radiation.
It seems to be working great. You know, I'm able to function, carry out work as normal. I'm grateful for every day. I'm blessed with every day. Don't take anything for granted.
It's a triumph, years in the making.
It really gives me hope.
Grace Haba, WRAL News.
So this is an NIH-funded research trial. Dr. Duckett, how might a long-term trial like this be impacted with the proposed cuts?
You know, that's such a great story, isn't it? It's such an amazing story. I think there's so many elements to that. So one of them is that this research takes decades to come to fruition. So the kinds of things that are happening now with as we think about downsizing our institutions across the country, and this was a collaborative study across the country with another institution, these things are you're gonna feel that effect, maybe not tomorrow, but you're gonna feel it because we're gonna be cutting off that research at the source. And that to me is the most chilling problem that we have here that we're facing. So we'll see these impacts, we'll see them in years to come. But you can predict that these things, as we talk about laying off jobs and closing down buildings and the kinds of things that we'll have to do, you're gonna see it in the future. And when you see it, it's gonna be too late to do anything about it.
Let's talk about the local economic impact, because I think that's really important here. So there is a new study out by United for Medical Research. It shows that for every dollar of NIH funding, it generates about $2.46 in economic activity. Dr. Wall, how is that playing out in our area? I talked about the fact that this area is synonymous with research. How is that now playing out in our area?
Yeah, that's a great question. And for one thing, studies like the one we just heard about, you have to think, if we had that 15% 5, 10, 15, 16 years ago, that study may not have happened. And how many countless studies won't happen because we just don't have the infrastructure to support that kind of work. So we won't know what we're even missing, but we will be missing. The other thing, as you point out, is the economics. If $2 are generated for every dollar that the NIH sends us, and I can tell you that's true. We buy equipment, we hire people. Now we're thinking twice about, should we be doing that? It's an uncertain future. So am I gonna hire research assistants? Am I gonna be able to continue hiring and keeping research assistants or other staff we have right now? So it really does have a ripple effect that can affect thousands and thousands of people. That study said something like 25,000 people just here in North Carolina, we're talking about are employed directly from research. So this is gonna have an effect on all sorts of people here in our area, in Triangle and in the state.
Are you laying people off now? I mean, is it happening now?
We're in the planning stages of doing that. It's happening right now. Yeah, in the coming weeks and months, we'll be doing that. And I think to David's point as well, places like UNC and NC State and Duke, we're generating a workforce, a highly trained workforce for RTP that is going to have so much impact over the economy of North Carolina as we go forward, as well as the U.S. This is happening everywhere, right? So yeah, we're definitely going to see that effect. I would also think about the small business owner, the restaurant, the coffee shop, all of those supply industries and the vendors that serve institutions like UNC and Duke are all going to be impacted as well. So there'll be many ripples to this.
So President Trump won here in North Carolina. He was elected here in North Carolina, and in part because he said that he would not do things in a conventional way, that he was going to break things in order to fix them. Do you just disagree with the way that he's doing it? I mean, is there a way that maybe some of the funding can be reeled in? Is there some way that you all can come to kind of a compromise?
Right, so I'm not a health economist, and I certainly don't work with the government. And again, speaking as a researcher for myself, I would say that there has to be a different way than taking this sort of sledgehammer approach. If we're talking about cutting costs, I think everyone's up for that, and there's ways to do that with more precision. To do this so abruptly, I mean, really does have implications, and we were kind of hinting at it, but there was a promise made that for a grant, let's say that I got or Dr. Duckett got, that's going to go on for the next 5 years. These overhead costs, this cost sharing, would be there for us year after year. We're being told now that won't be the case. So it's a little bit of a switcheroo, and I think that that's something we have to recognize too, that this is like a bomb dropping. This really does change everything almost overnight, and we're seeing that across many areas of the government. But there's a way to do this in more of a staged, precise approach, and then we're not seeing that precision. And I think it also reflects a lack of understanding of how research is done. To say, let's just cut this down to 15%. I think that's maybe a 30,000-foot view, and not an understanding of how research is done.
And really quickly, are you seeing layoffs at UNC right now?
No, so right now I think people should understand a lot of this is sort of those storm clouds gathering. Pieces are being put together. We haven't seen anything enacted yet, but just the threat, this is really key. Just the threat of this happening and anticipating and seeing what's happening across other areas of the government give us that kind of pause that is gumming up the works and already having an effect on research here in the Triangle.
Dr. Wall, Dr. Duckett, thank you all so much for your time this evening and for explaining it so well to us. I really appreciate it. Best of luck to you both.
Thank you.
Okay, ahead. What is the case for these types of cuts? We talked to a member of the conservative think tank, the John Locke Foundation, next. Welcome back. We have just heard from doctors describing the stakes of funding cuts on critical research. Let's hear the other side now. Mitch Kokai is with the John Locke Foundation, a conservative think tank in our area. Thank you so much for joining me, Mr. Kokai. So first question here. Do you think the way the Trump administration is going about making cuts to the NIH is a good idea?
Well, this is like what the Trump administration has done in a number of fronts, and that is kind of, as was alluded to, drop a bomb or throw a bomb into a room and then see what happens. That tends to not be the way that you get the ideal results in anything, but that's the way that Donald Trump operates. And I think a lot of the people who voted to put him back in the White House really wanted that approach. They looked at what's happening in Washington, D.C., how much money is being spent on all kinds of different things, and said, something needs to change, and this is the guy who's going to do something about it. To me, I think one of the more interesting things from the earlier segments was the discussion of the economic impact. One of the problems with that economic impact study is that it, like most economic impact studies, started in the wrong spot. You don't start with, okay, we spend the government money on this, and now what's the ripple effect? You have to start with, okay, what is the opportunity cost by taking the money out of the private sector, funneling it through Washington, D.C., and then sending it back to the states and the research institutions. And if you looked at the opportunity costs of taking the money and sending it to Washington first, you would see much less of an economic impact from having these types of studies. But that said, the main thing to know about this is that NIH is a $47 billion a year operation. And it has to be worth the cost for it to go forward. It has to be worth more than that money would be used for some other government purpose or back in the hands of the taxpayers. And unfortunately, for a number of years, NIH has had a questionable track record. There's been bipartisan interest in trying to get NIH to do a better job of making sure that all of these clinical trials that are funded actually get published. The results just don't get hidden somewhere and never get put forward to the public. We've seen letters from members of Congress, both Republicans and Democrats, long before the Trump administration came in. In fact, back when he was vice president, Joe Biden in 2016 was talking about taking money away from NIH because of some of the problems with the way the money was being handled. So this is not a new issue. This is not something that the Trump administration just invented. NIH has had some issues for a number of years.
I take your point. There should be an evaluation of these dollars, right? But the way that this is being implemented seems to be having a chilling effect on critical research. So what if the pause on some of these research trials comes at the expense of saving lives?
Well, that is a possibility. That's something that you have to worry about. And I, in listening to those doctors, are listening to them thinking, well, they are right to be concerned that the way that this is moving forward could have a chilling effect, could stop some trial that would have benefits in the future. But I think the other thing to keep in mind is that one of the things that is a fact of life in our section of North Carolina is that our economy is skewed more than most toward funding that comes from government. And when that becomes unsustainable, or when the winds change, you can have an effect in a place like the Research Triangle that's greater than you would in other parts of the country where the economy is more balanced and is more dependent on private sector activity. So that's something to watch out for. But certainly, as the Trump administration goes about this situation, as it has with many others, the idea of kind of throwing a shock to the system and then stepping back and perhaps getting to another result is what we're likely to see. I think the doctors who you talk to and their colleagues are right to be concerned, but they also should keep in mind that some of the things in this arena, as in others that the Trump administration has tried, you will see an initial polarizing and very impactful idea. Then as the courts play out various lawsuits as other factors get in, you will see
you think it'll be diluted, basically. That's what you're saying. Ultimately, that's a big proposal, and then somehow it'll be diluted. The question, I guess, is still the concern about how this might impact the local economy. Already hearing about layoffs, already concerns about people who are being furloughed. What do you say to the potential impacts to the local economy? I have 10 seconds.
I think there are potential impacts. It's something to be expected when your economy is so skewed toward being funded by the federal government.
Mitch Kokai, thank you so much for your time and for your perspective. If you have something to say about tonight's discussion, you can email us your comments, questions, or criticisms on the record at WRAL.com. Have a great evening.